Hi, everyone. So, I want to talk to you about the different parts of priority questions and answers. If you understand this, it's a lot easier to answer those priority questions that seem to be a problem for so many students. First, the questions or the scenarios, the answers most of the time are broken down into four parts. It's going to give you an age, a gender, a diagnosis, and a modifying phrase. Some of these we care about and some of them we don't. First of all, age. Age does not make you a priority. Being young does not make you a priority over an elderly patient. And I know when I was in nursing school, there were a lot of students who would pick the youngest person, especially if it was a baby or a young child, as the person that would be seen first in the emergency room, even if they had something minor like an earache, whereas an adult might be on blood thinners and had a fall, and they would rather let that person sit in the waiting room while seeing the baby with the earache. Meanwhile, the elderly adult on blood thinners could be bleeding out. So, again, age does not make you a priority, being young or old, either way. Gender does not make you a priority. Not going to get into the political stuff. But in nursing school, gender does not make you a priority. Being assigned male at birth or being assigned female at birth does not make a patient more of a priority than patients of the other gender. The next thing you're going to see is the diagnosis. This is the second most important part of the question. So, if, for example, you might see a 66-year-old female with COPD. That would be age, gender, and diagnosis. So keep in mind, COPD, chronic condition. Then it's going to give you the symptoms that the patient is having, also called a modifying phrase. This is the most important part of the question. Again, the modifying phrase, also called the symptoms, is the most important part of the question. So here is a practice question for you. A nurse is assigned the following patients for her shift. Which patient should the nurse assess first? A 68-year-old male with ARDS needing a sterile sputum specimen collected and sent to the lab. A 57-year-old female with COPD and a pulse oximetry of 90%. A 72-year-old male with pneumonia needing IV antibiotics started. A 51-year-old female with asthma reporting shortness of breath after using a bronchodilator inhaler. Let's look at these answers. First, the 68-year-old male with ARDS needing a sterile sputum specimen collected and sent to the lab. While doctors actually in your hospital might disagree with this, sputum collection is not going to be a priority. That is something that can wait until we have dealt with other patients. Our second patient was a 57-year-old female with COPD and a pulse oximetry reading of 90%. So remember, COPD is a chronic condition, and a pulse oximetry of 90% is an expected finding in someone with COPD. So while we do need to see that patient, she is not the priority. And our third patient, a 72-year-old male with pneumonia needing IV antibiotics started. Are antibiotics important? Absolutely. Is it ever a priority to give somebody antibiotics? No. So our fourth patient, a 51-year-old female with asthma reporting shortness of breath after using a bronchodilator inhaler. So a patient with asthma, which is a chronic condition, but it is in an acute phase of her chronic condition. She is having shortness of breath even after using her bronchodilator. Therefore, that is the patient that we need to see first. We probably need to get them a breathing treatment, respiratory therapy on board, that kind of thing. So, number 4, that is the patient that we would see first in this situation. The do's and don'ts of prioritization questions. Do prioritize a right now task. Don't prioritize a task that is continuous. Do prioritize based on which patient is going to die first. Don't prioritize exclusively based on ABCs, because if we would have done that earlier, then we would have gone back and forth between the patient with asthma and the patient with COPD. Um, and pain is never a priority. There are some very rare cases in which it is the priority, which you will learn about in nursing school. And once you get to the floor as a nurse, but in 4 questions, for these prioritization questions, you are never going to prioritize pain, even if it is a 10 out of 10. Um, Pain's not going to kill somebody, but having shortness of breath after using a bronchodilator, that's going to kill you. And these are just some other videos that I have coming soon. So keep checking back. I'm doing my best to get them up for you guys. Again, if you have any questions, you can drop them in the comments. If you're at STLCC, shoot me an email, shoot me a text message, and I will get back to you. Thank you.